So we're really trotting along at a very fast pace here, so hopefully everyone's managing to sort of absorb everything as we go. So next up we have Dr. Matthew Nguyen. So he is a trainee nephrologist or kidney specialist at Westmead Hospital, and is here to talk to you about how best to care for your kidneys. Thanks, Matthew.
Thanks so much. I recognise that we're a little bit short of time. I'm actually starting at my end time, and I also recognise that there's a broad variety of us here. So whether or not we have extensive experience and knowledge in kidneys, either with ourselves or with our family, or we're starting the journey for the first time. I will also try to figure this out. Great, so a lot of the resources I'm using today are actually found quite easily online, and I would actually recommend them as well. So the two ones would be Kidney Health Australia and also from the National Kidney Foundation. Plenty of resources, plenty of information that you would want at any sort of topics really, and cater to really many stages as well. Just start by saying with the kidneys, I obviously have a personal bias being a nephrologist, but kidneys are an amazing organ. Kidneys, they're relatively small, so each are the size of an adult fist. Most of us have two, and they work hard. They have roughly a quarter of the blood supply throughout at any point in the time, and they just work silently in the background. So blood flows through, it gets filtered through the filters, also called the nephrons or the glomeruli, which are just the filtering units of our kidneys, the washing machine, so to speak, for the blood, and it just goes through and gets recirculated back into the body via the veins. Of course, kidneys produce urine. It goes through the tubes, the ureters, into the bladder, and then out to the outside world. So what's kidney disease? Of course, we've heard so far that amyloidosis can cause kidney impairment through the buildup of protein, but kidney disease in of itself is simply just the reduced ability to remove the waste products, which is what the kidneys would normally do. So it would be a washing machine for the blood. However, there's a reduced ability. There's a buildup of excess fluid and also waste products. The reason is because there's a loss of the filters. So we have millions. Each kidney has millions of filters, or the nephrons, to help clear things. And there's a slow, gradual loss of these. And I'd just like to say that there's probably a difference between an acute or a sudden impact to the kidneys or a slow decline. Chronic kidney disease, as is the nature, is typically gradual. It just is a slow progression over time. That also means there's plenty of opportunities along the way to be mindful and also to intervene as well. Even though we may be making urine, the urine itself may be not of good quality, so to speak. So there may be not enough quality waste products being released despite the amount of urine. And the buildup of the waste products can cause symptoms. So you can feel tired, you can have reduced appetite, you can have swelling of the legs, among other things. Many causes of chronic kidney disease. I've sort of listed a few of them. Obviously, it's not an exhaustive list, but the common ones would be diabetes and high blood pressure. But I've lumped glomerular disease to also include amyloidosis as well. So amyloid-related kidney impairment, or the buildup of protein, which then affects the glomeruli or the filters of the kidneys. What can we do to find out if we have kidney impairment? I have a pretty easy job. Blood test, creatinine. It's ubiquitous. We do it all the time. It's a very common test. The creatinine leads to something that's called the estimated glomerular filtration rate, or the eGFR, and it's just a percentage of how well our kidneys are functioning, is the best way to think about it. Not an exact science, but the easiest way to think about it. There are urine tests to see if there's any protein in the urine, which again is more relevant for us here today. Imaging, and also kidney biopsy to see exactly what's going on. This is what I mentioned about the eGFR, the estimated glomerular filtration rate, or the so-called percentage. Now, this picture, so it basically says normal on the right side there. I always like to preface by saying there's no such thing as normal. It's all individualized, it's all contextualized. However, it is a useful way just to understand that there is sort of a percentage of our kidneys, and there is a potential decline to the left as well as time goes on. In terms of what to be aware about, there are many things, but I'd just like to focus on two things, that being medication related and that being diet related. And Ellen's actually already done my job in terms of diet. I'll just do the medication changes. just to say that the kidneys, they filter a lot of things from the blood, and also it's quite clever in terms of what it filters, but it also does filter a lot of certain types of medications as well. So the reason why that's important is because when you have kidney impairment, then some medications may not be cleared so well, and in fact may not be safe when there is the kidney impairment to the lower stages. On the flip side, there are also medications which may affect the kidneys as well. So this is definitely things to be talking about with your doctor. In terms of fluid restriction, it's a bit tricky. I can't emphasize enough, it's individualized. There's no prescriptive thing per se. It's just helpful to have certain numbers associated with it. Sometimes, for some people, fluid restriction can be important, especially if you have leg swelling or buildup of excess fluid, because it's about maths. Whatever goes in needs to equal whatever goes out if we don't, or be less than if we don't want to build up fluid. And there's no sort of quote-unquote bad food or diet. It's just whatever's moderated, and I just like to say it's a kidney-friendly diet as opposed to anything, again, prescriptive. And of course, this would be salt and other minerals or electrolytes, the classic one being potassium for the kidney specifically. Ellen spoke about labels. I spend way too long browsing, Woolies and Coles, looking at labels, and my partner's like, "Where are you?" But labels are great because it actually shows you at the very bottom there, circled in red, sodium. So they're looking at sodium, trying to figure out which one is high in sodium, what's low in sodium. Now, this one I've taken on the top right side there, I've taken from the National Kidney Foundation, and it says 6 grams. But again, these are numbers, and I think the helpful things to understand is actually, 6 grams is not much at all. It's just 1 and a bit more teaspoons of salt. So it's quite shocking to understand that the recommended, so Ellen said 2 grams, and again, that would be even less. It would be even less. It'd be basically a quarter of a teaspoon of salt, not much at all. Fluid-wise, if you're not on a fluid restriction, then just making sure that you're not being too dehydrated. So bottom right there, if your urine is more concentrated, implying that you're dehydrated, have a little bit more, basically. What's the treatment available for chronic kidney disease? So I think the nature of it is that it's a lot of it is a slow decline, which is difficult to reverse, but the key steps would be to reverse things where possible, to have healthy living, generally speaking, healthy living, what Ellen already mentioned. And also there are medications specific to kidney health as well. And it's actually an exciting field for sort of kidneys and kidney specialists and kidney patients as well, in that there's a lot of new emerging ones for the kidneys, among other things as well. And of course, managing the complications that might arise from kidney impairment. What happens at the latter stages, or kidney failure? And when to intervene, it's variable, depends on symptoms. You may be surprised to understand that actually you may not get symptoms until the very, very end, the single-digit type EGFRs. 3 methods would be supportive care, dialysis, or kidney transplant, or these are just basically kidney replacement therapies. And again, more details with your doctors. The key takeaways to wrap up is that often it's a gradual process. The buildup of waste products, which is what the kidneys are meant to be clearing out, can cause symptoms. There are many ways to help slow down the kidney impairments, and that can be medicine related or non-medicine related. And I think the big takeaway is that actually it's not a big thing. It's small changes through time can make a really big impact. And I'll leave it at that. Thank you.